Hi, good evening to everyone. My name is Dr. Sourav Goyal. I am a consultant nephrologist. I am currently practicing in Moga, Punjab. And today we are going to discuss a topic which includes pedal edema, chronic kidney disease, and how pedal edema it is an indicator of chronic kidney disease. We will be discussing briefly regarding what is pedal edema, what is chronic kidney disease, and what are the stages of chronic kidney disease, and how pedal edema is diagnosed, and how pedal edema is treated. So, what is pedal edema? Basically, pedal edema it is accumulation. It is the swelling which occurs around feet and ankle. This is called as pedal edema in layman language, and it is an important sign which can occur in many disease, and it may be the first sign which occurs in disease such as chronic kidney disease, in chronic liver disease, chronic heart failure. So this can be the first symptom which a patient observes. So it should not be ignored. And like how this pedal edema it occurs in a patient of chronic kidney disease, as I've already said, it may be the first sign of a patient suffering from chronic kidney disease. Pedal edema it can be physiological and it can be pathological. Physiological means when it occurs in a person who is not suffering from any disease, but this pedal edema occurs in that patient, it is called as physiological. And if it occurs because of the presence of any underlying disease or any health disease, then it is called as pathological. How pedal edema is caused? Basically, we have a very small capillaries or blood vessels surrounding the tissue in our feet, and when these capillaries or small blood vessels, the fluids, it leaks out of these vessels, it accumulates around the tissues, leading to the development of edema. So this fluid, why it leaks out of capillaries or small vessels? This fluids leaks because of low protein in our body, which may be happening because of chronic kidney disease, or it can be due to the chronic malnutrition. So, or it can be due to the excess fluid in the body, which can be due to the suboptimal functioning of kidneys. So kidneys are not able to flush out the water, so swelling occurs. And like what can be the causes of pedal edema? It can be caused, as I've already discussed, it can be due to physiological reasons or it can be due to pathological reasons. In the pathological reasons, it can be due to the chronic kidney disease, it can be due to the liver disease, it can be due to thyroid disease, it can be due to heart failure, it can be due to the drugs, or it can be due to the chronic malnourished or malnutrition patients. There can be variety of causes. So whether this is physiological or this is pathological, this has to be examined by the treating doctor. He will examine the patient. He will see that whether this edema leaves a pit when it is being examined or it is normal. So accordingly, it is planned. And regarding our today's topic, we are discussing pedal edema in the context of chronic kidney disease. So, what is chronic kidney disease? Basically, chronic kidney disease it is the structural and the functional abnormality occurring in the kidney, and this structural and functional abnormality lasts for at least 3 months. Then we label the patient is having chronic kidney disease. This chronic kidney disease, once settles in, the patient suffers from a permanent kidney dysfunction. What can be the cause of chronic kidney disease? It can be due to the blood pressure, high blood pressure. It can be due to diabetes. It can be due to renal stones. It can be due to any internal kidney problem, which we called as glomerular diseases, or it can be due to the autoimmune diseases called as vasculitis. And there are lots of other causes also which can lead to the development of CKD. Once CKD develops, its severity is seen according to the stage of chronic kidney disease, and stage of chronic kidney disease is divided into five stages according to the glomerular filtration rate, which we calculate and we also measure, that puts the patient into particular class of chronic kidney disease. And to diagnose a chronic kidney disease, we have to get the battery of tests on the patients. Like we can order the blood tests in the form of serum creatinine. We can get the urine examination of the patient done to see whether whether there is proteinuria, whether there is protein occurring in urine, or whether there are RBCs or whether there are casts. We have to see the urine, we have to see the creatinine, and we have to see uric acid, we have to see other causes of chronic kidney disease, and we also have to get an ultrasound which will tell us about the kidney size, which will let us know about the renal stones if they are present. We can also plan of a renal Doppler which can tell us about the any narrowing occurs in the blood vessels of the kidney, which is called as renal artery stenosis. And there are other tests also which a physician would like to occur. And when the pedal edema, regarding the pedal edema, how it is diagnosed, it is diagnosed on clinical examination. Patient will tell you that there is a swelling which occurs on his feet. The physician or the nephrologist will examine it. They will see the swelling, whether this swelling is widespread, it is on one limb only, or it is on the both sides of legs. If it is present on the both legs, then the causes are different, and if it is present on the one limb, the causes are different. And the swelling is seen whether it is when the pressure is applied on the ankle and the ankle joint for approximately 20 to 30 seconds, and it leaves a pit, then it is called as pitting edema. It is normally seen in the patients of heart failure or in the patients of chronic kidney disease. And apart from these, other causes like hypothyroidism, liver disease, heart failure, it has also been shown to be development of the pedal edema. And once you are confirmed with the diagnosis of pedal edema, and you have to look for the etiology of pedal edema and then treat the patient accordingly. If the pedal edema is physiological, like it is without any underlying disease, it is treated by the supportive management in the form of decrease in the salt intake. We have to advise patient to keep the lower limbs elevated, like they can use pillows beneath their legs, and physiological swelling will subside away. We will tell patient to reduce the salt intake. And if it is due to some drugs like commonly used blood pressure medications like calcium channel blockers, they can cause the pedal edema. So we have to switch over the medications. And if it is pathological, then we have to use the drugs which are called as diuretics to make the patient get rid of edema. And these diuretics, they are easily available, but we have to see the exact dosages required by the patient to get rid of this edema. If patient is suffering from heart failure or chronic kidney disease or liver disease of advanced stages, they may require a very high dosages of diuretics. And also, when we start patient on diuretics, we have to continuously monitor their electrolytes, their kidney functions levels, because excess use of diuretics can cause dehydration and can cause electrolyte imbalance. So we have to keep a fine balance between the symptoms and the examination and the medical reports. So this is the a brief talk about pedal edema, chronic kidney disease, what is physiological edema, what is pathological edema, how chronic kidney disease is diagnosed, what are the stages of chronic kidney disease. Like there are 5 stages of chronic kidney disease. It's stage 1 to stage 5, depend upon the GFR. The GFR is calculated. You have number of automated tools in your mobiles built which can calculate the GFR of patient. For that, you just need a creatinine and the age of patient, and you can know the GFR. And we have to see that whether this edema is physiological or whether this is pathological. And once we are confirmed with our diagnosis, then we have to use the diuretics, the drugs used to treat the edema, to give the patient the desired relief. Thank you. This is all about the pedal edema and the chronic kidney disease and the diagnosis and the management.